Hey guys, getting calls all the time. This is Doc right over here. Dr. Davis, good morning to you.
Good morning. Hi, how are you?
So you've been getting calls from ladies saying that they want to have hands, maybe they're bony or skinny, and they want to have beautiful engagement hands?
Absolutely. With all the facies and things like that that people are taking with their phones, they want to make sure that the ring looks good and the hand looks good.
We have a new bride over here. So why do you want to have your hands, you know, just more fancified?
Well, there seems to be a growing trend on social media in regards to engagement ring selfies. So, of course, as a new bride, I started to pay more attention to what my hands were looking like. I would like to see a bit more a fuller look to my hands.
Yeah.
And so, yeah, that's pretty much it.
Well, Melissa's beautiful. We're going to get started. Would you look at this ring? Seriously. Can we just take a look at this ring? Gorgeous. All right. As Doc gets ready to start this, what are you going to be putting into her hand? What are you doing first?
The first thing we're going to do, we already topically numbed her hand, and now what we're going to do is we're going to put a little bit of filler in, the same kind of stuff that we would use to make the lips fuller or wrinkles around the face made more plump. We're going to use the same thing right in the hands.
So like a Restylane or a Juvederm. Okay, I'm going to let you get started so we can see the before and after. We're going to take this wide. So as Doc does his work, because you're maybe eating your breakfast and you don't want to see that, we'll wait a sec. Let's see a before and after picture, because this is the effect that people are trying to go for. A lot of women, as we get really, you know, thin, you can have your hands be kind of bony. So you can see one picture with what it looks like before, and then another picture where you can see it's just fuller, and that can make your hands look prettier. And then also women are also getting like little peels as well, Doc, on their skin in order to make it you know, just look younger and get rid of brown spots?
Little brown spots, lines, wrinkles, things that you would normally do, let's say, for a facial, we can now do for the hands, and a lot of people are doing that.
Does it hurt?
No, not at all.
I'm doing it right now.
That's all right. Just take a stop for 1 second. Let me just show the audience, because you can see it's already getting fuller now. So then what do you do to spread this around?
Yeah, we just really manipulate it, just like I'm doing right now. You'll see in a second how the hand just looks all of a sudden fuller. And if you take a look, you'll see each one of these little alcoves, if you will just be filled up a little bit, and it'll look, I mean, she has beautiful hands to begin with, but these will just make it a little bit more plump.
Wow, it's kind of amazing. Congratulations on your wedding. The reception is going to be this Friday.
Yes.
You're going to look beautiful no matter what.
Thank you. Thank you. I appreciate that.
All right, guys, back to you. Take away from the needle, but it does look amazing.
Yeah. I'm never getting married.
Flip season, so lots of people are out there, out and about. This is Kara. She's absolutely gorgeous and beautiful, but she does not love her feet. Now, I think her feet are cute, but she would like to have them more cutified. So Doc is here to help. New treatment that women are doing. She's a waitress, and she's always on her feet. So she's like, help me, Doc. We will show you what she is getting done. Coming up, guys. So this is filler to make them look, you don't have thin, bony feet that look all, you know, just thin and bony. This is Kara. Beautiful. Okay, so she's a waitress. So she's on her feet. You know what that's like when you're waiting tables. Morning to night, it absolutely bangs up your feet. I think she's got beautiful feet. Kara, what would you like to see done to your feet, and why?
Like I said, because I'm on my feet all the time, I just feel like it's starting to take their toll, and I just feel like, I don't know, they need to be a little bit prettier for flip-flop season.
All right, prettier for flip-flop season. So Doc's here. What are you going to do, Doc?
We're going to put a little bit of filler in this area, and you know, it's becoming the new essential for the summer. Patients want to have their feet looking great, and this is a really easy way to do it. If they like it and they really want to make it more permanent, we can always take a little bit of fat from somewhere and inject the fat into the feet. But today we're just using one of the fillers that we normally use in lips and creases and things like that, and it's totally reversible if they wouldn't like it, but it will make them look really nice.
Okay, I'm going to let you get started with your needle. Because you're eating breakfast, we're not going to show you that part, so I'm going to let you go ahead and get started. Let me show you a before and after picture of why some people would like to get their feet done, because sometimes your feet, especially women, we can have very thin, bony feet, and then you put a little bit of filler in, and it just gives them a fullness, and it, you know, takes away some of the years on that. Now, how does it feel, Kara?
Doesn't feel that bad.
She had it numb before. We showed you at the top of the hour she was having it numb. So right now we have the needle going in, and so it's pretty impressive. And you don't feel that?
It's just a little bit of pressure. No, not really.
All right, Doc, now how much do you put in, and how much is this going to cost me if I wanted to get something like this done?
It probably starts at about $300 and it can work its way up depending on how bony or how, you know, depressed those areas look. But, you know, in Kara's case, she really has beautiful feet to start with. We're just going to plump them up a little bit. But everything really has to do with when the patients come in. Some patients really have it going all the way back up to their ankles. So they really want to have the foot like from the ankle all the way to the toes really looking more plump. In this case, we're really just doing it right from the toe area. And it's kind of like what you would see in a flip-flop.
Who normally comes in to get this kind of thing? Is this going to be, I would think, as we get older, everything gets a little bit thinner and skinnier kind of thing in terms of our hands and feet?
It's true. I mean, you would normally think that an older person would start to see some of that wasting away of some of those really soft tissues in the feet or the hands. But with the way people are taking selfies all the time of their feet and their hands, and they're trying to like really look as best as they can be in every kind of photo, we're seeing younger and younger people do this. And let me add that it is a preventative way, because a lot of times these things that we're injecting, and also some of the peels and lasers that we do, really prevent problems from happening, like skin cancers on the feet or on the hands, or just seeing that aged appearance to the hands. If you're taking off those old, dead, dried cells, you're going to have a very youthful look to the hands or the feet.
I like what you said. Now let me see what we've done so far. We just put a little bit right here. Right. But you said that it's reversible. So say it goes crazy and I'm like, I cannot stand the way that looks. What do you do to fix it?
Yeah, we always love that. There's a antidote to this. So this is a hyaluronic acid, and we have something that's an anti-hyaluronic acid that we inject right into the area, and it basically washes it away. So if someone's looking at it and they go, you know what, I think maybe it's a little bit too much here, a little bit too much there, we can really take it away that way. And the same thing applies if we're putting it in the face and things like that. But once someone really sees it, my experience has been they love it, it lasts about a year, and then they want something more permanent. And that's when we would go to something maybe like a fat injection. All
right, Doug, I'm going to let you continue with this. Cara, you're holding up great. You look beautiful. So best of luck. She met somebody. Her mom's here. She met somebody. Can I say that? She's mortified.
She met somebody at the office?
In any event, so
what?
Not at the office. I'm not going to give away all her private business, but that's
intriguing.
Yes. Back to you guys.
Hey, Karen, could you ever put her feet flat on the table there, or the bed, whatever the heck it is?
Let me show you. You want to see? Oh, he's doing it right now. Oh, hold on one stop.
Or just
come
have
back
her
and take a
scoot
look,
up
George.
and put her feet over the side.
Scoot up and put your feet flat down on the thing so we can
There
see
you
them.
go. Now, oh my goodness, I can see the tops of her feet.